everyone, and welcome back to XGate Dental. I'm Emmanuel Kadosh, and we are here to discuss new procedures in the field of dentistry. We will provide interesting new cases to exhibit how doctors use our products to solve complicated dental cases, so don't forget to subscribe and follow to stay up to date. So let's get started. Today we have a case where you can see in this CT that the patient had a metal bridge on 2 teeth. Now, the teeth with extensive caries were extracted without question, and you can see that from the teeth there are almost nothing left. You could just take out the bridge and probably with 2 fingers. And in this case, you need to have some kind of restoration. So the first thing we want to do is we can place implants in the bone where we don't have the teeth, and we have enough bone for 2 implants. It'll be enough for this kind of restoration. So as you can see, this is the metal bridge. The bridge has a little bit of ceramics in the buccal part, and it's clearly broken. It's a little bit worn off. This bridge was made a long time ago, and this is what's left from the teeth. The bones are okay, which is quite surprising because in many cases when the bridge is without any pressure and when the bone is without any pressure and don't have teeth or implants, we have some bone resorption. So in this case, the fact that we have enough bone is actually really surprising. So we placed 3 implants. We placed 2 implants in between the teeth that we extracted and 1 implant near the tooth. These are implant level scan abutments. You can see the difference between the different multi-units that we used. This multi-unit is V-type multi-unit, and you can see that the line on the scan abutment, and this is the D-type multi-unit. So beneath the scan abutment can be either angulated multi-unit or a straight one. In this case, in here, we probably have an angulated multi-unit because the angulation of the bone is going to the buccal part. And this is an anterior tooth. So you'll have the screw channel in the buccal part of the crown. And this is something that you don't want to have for aesthetic purposes. And those 2 multi-units are more posterior. You don't see the screw channel, and it's much simpler to have a restoration on straight multi-units, even with such a big angle. When you are using multi-unit V-type, you can see straight multi-units when you have a little bit bigger angulation. It still fits and everything is fine because it has smaller cone, and you can feel it when you have a 30 or 40 degree angle. You can see the multi-units and the healing caps. You can see that on tooth 14, we have an angulated multi-unit, and the other 2 multi-units are straight B-type multi-units with small cones. You have the healing caps on the multi-units, and in here you can see that the original angulation of the multi-unit will be quite angulated, and you'll have the screw channel right in the middle of the tooth. So that's something you don't want to have because it will be problematic in the aesthetical aspect of the restoration. So we use the angulated multi-unit even though you can see some part of the multi-unit outside of the gingiva. Now, with angulated multi-units, the biggest problem is that you have the buccal bulge. You could use a V-type, but if you use a straight multi-unit, you can still mill the bridge and you can fit and everything will be fine, but you'll have the screw channel in the middle of the tooth. So this is a problem that you don't exactly want to deal with because it's quite an aesthetical issue, and it's a much bigger problem than a little bit of an anodized titanium coming out of the gingiva. So it's much easier to handle a little bit of a buccal bulge that you can see than the screw channel in the middle of the tooth. Now, you can use a multi-unit as a stopper, but with this big span of a bridge, you'll have 3 crowns in the area. It's something that can be problematic with different forces applied on the bridge. And either way, you'll have to compromise. So the question is, what is the smallest compromise or the easiest to deal with? In this case, the smallest compromise is the buccal bulge that you can see. And in this way, you'll have a good bridge. It'll hold and it won't break. And if you have a stopper, it can break. And if you have a straight multi-unit, then you'll have a screw channel in the middle of the tooth. That's something that is hard to deal with. Now, after the healing process, you can see a little bit of plaque that needs to be cleaned. And next thing you'll do is take out the healing cap, take impressions, and make the bridge. So in this case, we made a bridge from monolithic zirconia. You can see different types of sleeves. Now, one sleeve is for the angulated multi-unit, and the other 2 sleeves are for the straight multi-units. So this is the angulated D-type sleeve, and those 2 are the V-type sleeve multi-units. Those are the multi-units, as we said. This is the angulated one that the implant is angulated in this way, and here we mounted the final restoration. We closed the holes, and because we have a large contact point, we use a big burr because it's much easier to get a nicely smooth finish. This is the final restoration from zirconia, and this is a little bit of titanium that you can see. Thank you everyone that joined in to learn some new and interesting information. Make sure to stay tuned for more. And of course, don't forget to subscribe, like, and follow. Thank you and see you guys next time.